Hi, I'm Josh Schmidt. I'm one of the instructors for PHE 150, which is the Prevention and Emergency Treatment of Athletic Injuries. You're about to see several videos for taping such as ankle, wrist, some compression wrap, so that it'll help you review during the time of studying that you need for this class. We'll cover these classes, or these tape jobs, excuse me, more in depth as the class progresses in the semester. So if you have any further questions, please contact me and have a great semester. This next tape job is a standard wrist tape job for athletes that maybe have a slight sprain or a little bit of a bruise or just want a little bit of extra reinforcement around the wrist, especially like a volleyball player where they're doing a lot of hitting, maybe a baseball pitcher, so forth and so on. So there's a couple of components that are optional in this case. Unlike the ankle tape job where we're going to want to spray, we're probably going to want to use pre-wrap. A wrist is optional. Sometimes I'll spray depending upon how sweaty the athlete might get, so the tape does not slide. And usually, especially on a male athlete with a lot of hair, I'll probably use pre-wrap. So I'm going to show and demonstrate pre-wrap. Again, there's no real good method to it. We just want to lay it down. It's to prevent the tape from sticking so much. All right, and then there's a couple of keys that we want to make sure the athlete is in good position to allow this tape job to be effective. One is you can see that her fingers are fanned out. This helps lock in the wrist or the carpal bones and makes it more effective. And it prevents you from taping so tight that you cut off blood flow. All right, I like to do a little bit of a fan tape where I'm going to kind of come around like this and angle my tape so it's a slight angle like this. And I'll do usually 2 to 3 strips working down slightly. And this creates kind of a wedge behind the hand and wrist itself. Then I'll actually do a continuous wrap with just slight pressure, like you would do a compression wrap, up about 3 or 4 strands of tape and usually end it here. And this, again, we want to make sure we don't cut off any circulation of the hand. It's real easy to do that in the case of the wrist. And what we're trying to prevent is just a little bit of extension of the wrist. And you can obviously modify this. The more and the higher I go, the more tape I put down and the higher I go on the hand, the more extension I'm going to prevent. So it's all athletic dependent. If it's a shot put thrower and they have a lot of weight in their hand, you might want to beef this up quite a bit because they got 14, 16 pound shot put. That's going to be forcing extension. If it's a volleyball player and they need a lot of mobility, we're probably going to do a little bit less. So it's all independent to the athlete.